Hi, I'm Heather, and I delivered my boy-girl twins at 25 weeks at St. Joe's NICU. As a mom who's been through the NICU, my advice to you is to take every moment as it comes. Every second, every minute, every hour. The experiences and challenges here can come really rapid, but eventually they end and you'll be on the other side with a lot of other families who've gone through the same experience. I think if we'd been able to watch a video before we ended up in the NICU, even if it would have just been the night before when we thought we might end up in the NICU, when it seemed really real at that point, I think that my husband especially and myself would have felt a lot more comfortable about some of the technology in use in the NICU and also about how some of the other families and staff are dealing in the NICU. I thought that it would have helped us cope a little bit better emotionally and a lot better just with the setting in general, because a critical care setting like the NICU can be overwhelming even when it's not your child. So when both your children are in there, it's a lot to swallow. While your children are still here in the NICU, it's really important that you can appreciate the security and monitoring that the NICU offers so that you can take a little bit of time for yourselves and enjoy a little bit of the comfort that the NICU experience can provide.
This video tour was created to familiarize you with the NICU at St. Joe's. Hi, I'm Carrie, one of the many board-certified NICU nurses specially trained to care for your baby. Myself, along with the many doctors, nurse practitioners, nurses, respiratory therapists, and neonatal care technicians are here to meet the special needs of your baby and to answer any questions that you might have. Before we start the tour, let's discuss a few housekeeping items. Upon arriving in the NICU, always remember to wash your hands before you touch your baby. There are many sinks around for your convenience. Using soap and warm water, lather your hands while singing the happy birthday song to yourself in honor of your little one. That is the proper length of time to rid your hands of harmful germs. Alcohol-based hand sanitizer is a good method for washing your hands, but should not be the primary method. Soap and water is best for your baby. We're also a fragrance-free and smoke-free environment, so please keep that in mind when preparing to enter the NICU. And very importantly, little do we realize that cell phones are major carriers of germs and disease. If you must use your phone, please disinfect it with one of the antibacterial wipes found throughout the unit, made specifically for cell phones. You don't want your phone to recontaminate your freshly washed hands, and you certainly don't want to pass those germs on to your baby. Now that we're done with those few but very important housekeeping items, we welcome you inside the NICU. A healing space where we're here to take care of your baby so that he or she may grow strong and prosper. If your baby is delivered very prematurely or needs additional assistance, he or she may come to one of our state-of-the-art stabilization rooms for care right after delivery. This room is immediately adjacent to the C-section surgery suite where you will never be far from your baby at any time. This room features state-of-the-art technology and equipment available if needed. After your baby transitions, he or she will be moved to one of our 30 NICU bed spaces. This bed space contains your baby's isolette or crib, items to care for your baby, and a place for family. Here, in this private space, skin-to-skin contact is encouraged, and this is where you are welcome to feed, hold, and care for your baby. We also have the ability to store your breast milk. The nurse's station is a central hub where the healthcare team collaborates on your baby's care. Even if we're not immediately at your baby's bedside, he or she is being monitored at this station 24 hours a day, 7 days a week. For babies with less intensive needs, their bed space may be located in the special care suite of the NICU, where you will enjoy the same exceptional care from the same specially trained staff. This is where babies stay until they're closer to discharge and ready to go home. Our private lactation room is located on this side of the unit, as is a nutrition room and the restroom. The nutrition room is a clean environment where staff store and prepare your breast milk and formula for you. Outside of the NICU, we have many family-friendly amenities to make your stay more comfortable. And with the mother-baby unit on the same floor as the NICU, you're never far away.
We hope you find comfort in knowing some of the services available to you, your baby, and your family in our state-of-the-art NICU. We also offer many programs sponsored by our Family Advisory Board designed to support your family while your baby is in the hospital. These include orientation and discharge classes, Educate and Create, Pizza Night, and our parent-to-parent mentoring program. We know this may be a challenging time for you and your family. Our entire staff, along with our active Family Advisory Board, work very hard to make sure you feel supported on this journey. We are all here to provide a caring, nurturing environment for your precious baby and for your family. For additional information, please speak with your nurse, visit our website, or call 734-712-3328 and ask to speak to one of the neonatologists. On behalf of the entire team in the Neonatal Intensive Care Unit here at St. Joe's, we wish you and your baby well.